Hi, my name is Cassidi Dailey Kalejta, and I'm a genetic counselor at Geisinger. Today, what we'll be talking about is familial hypercholesterolemia and certain education related to this condition. We'll talk about the different tests that can come with familial hypercholesterolemia, along with what we can do with this information after we learn more. There are different options for testing for familial hypercholesterolemia, or FH. The first is a cholesterol test. This is a simple blood test that can be ordered by your provider. And what it does is it looks at different levels of cholesterol and other lipids, which are fats that circulate within the blood. When we perform this cholesterol screening, what we're looking at is those actual levels from the blood and determining whether those levels are low, in the right range, or high. And because we know that individuals who have high levels of cholesterol are at an increased risk for heart attacks and strokes. The second option for testing for FH is genetic testing. And with genetic testing, we're looking at an individual's DNA. So to use an analogy to help explain this, you could think about DNA as a book and all the different words and chapters and different meanings within that book. And we could break that book down further to talk about the chapters, which are similar to in your DNA to different genes. And to take that one step further, we can look at different misprints or errors within a chapter, which relate to the variants that we could see within genes. So everyone has genes, everyone has DNA, and everyone has variants within their DNA. But for FH in particular, we're looking at particular genes or chapters of that book and looking specifically for particular misprints or errors within that chapter that are particular variants that increase the risk of FH. For those who have a gene that has a variant within that gene related to FH, it means that their body cannot process cholesterol within the blood, and that leads to high cholesterol levels within the blood. There is a difference between cholesterol blood screening and genetic testing. When we're doing cholesterol blood screening, this is really a snapshot in time of an individual's cholesterol level, but it doesn't necessarily tell us why that individual's cholesterol level is high. That's contrasted with genetic testing, which gives us an indication of whether or not this condition is inherited within a family and can let us know who else in the family may be beneficial to have genetic testing, along with what treatment options may be beneficial to an individual with an FH diagnosis. Many patients have questions about the cost of genetic testing, and the good news is that most insurance companies do cover some of the cost of genetic testing. Additionally, most patients have a low out-of-pocket cost when they do engage with genetic testing. It's important to know that most genetic testing laboratories have experts in the billing space that work closely with your insurance company, along with you as the patient, in order to determine what those out-of-pocket costs may be. Some patients may be concerned about their privacy when it comes to genetic testing, and the good news is that there are certain protections in place to cover your health information. The Genetic Information Nondiscrimination Act, also called GINA, is one such protection that covers your genetic information. If an individual has a positive genetic test, then GINA would cover their health insurance along with their employment. And what this means is that a health insurance cannot change coverage options or change charges to an individual who has a positive genetic test. Similarly, an employer cannot make employment decisions based upon an individual's genetic status. If you find out that you have FH, it's important to talk to your healthcare provider as a next step. This is because it's important to discuss the available treatment options, as well as the different testing that may be available to you, like cholesterol blood testing or even genetic testing for other family members. If you have any questions, please reach out to your healthcare provider. And on behalf of Geisinger, thanks for joining us today.